It's a great honor and pleasure to be speaking in front of you all today. The topic of my presentation is on mental health and post-secondary education. What is it like for students with autism spectrum disorder, and what does the research say? I have no conflicts of interest to disclose today. So in terms of the scope of the session, I'd like to review factors affecting post-secondary educational functioning for students with ASD. Then I'll present a section of my doctoral dissertation results, which investigated the lived experiences of students with ASD attending college or university, and then briefly discuss implications and recommendations for best practice, including future research. Throughout this session, I may use the terms college and university interchangeably. And as you can see at the bottom, pseudonames are used in this presentation to protect the anonymity and confidentiality of the research participants. So as we know, we're seeing an increase in diagnosis in children with ASD, and more children are being identified with ASD without significant cognitive impairment, so without co-occurring intellectual disability. Research has shown that the deficits with ASD do indeed persist into adulthood, and a recent epidemiological study has shown the prevalence rate of adults with ASD to be 1%, so not too far off from our prevalence rates for children. Given that we're identifying more children with ASD without significant cognitive impairment, it has been argued that we're likely to see an increase in enrollment of students with ASD in post-secondary education. Indeed, studies have shown that students with ASD have aspirations of attending college or university, but of the outcome studies that have been conducted, the outcomes have been poor in terms of post-secondary educational functioning, including lower enrollment rates compared to students with other disabilities, a higher risk of no enrollment, and a higher risk of dropping out soon after entry. Now, you might be wondering, why are the post-secondary educational outcomes poor for students with ASD? We know that college and university is a challenging time for any student, regardless if you have a disability or not. But there are cardinal features of autism spectrum disorder that are likely going to affect functioning in post-secondary educational settings. So for example, we know that social interaction and communication is a key deficit in ASD. And in college and university, we spend a lot of time having back and forth reciprocal conversations. We need to understand and read social cues, which can be difficult for some of our young adults. And there's lots of sarcasm and jokes and social chit-chat that occur on college campuses, which may be hard for some of our students to pick up as quickly as a student without autism spectrum disorder. And we also know that it's a time where we find a lot of common and shared interests with other young adults and students, and those form very meaningful relationships. With regards to romantic relationships, this is often a time where many people develop romantic relationships and find life partners, but studies have shown that students with ASD sometimes show excessive social overtures, which may come across as obsessional interest, unfortunately. Now, with regards to restricted and repetitive behaviors, it's been purported in theoretical papers to interfere with both socialization in college and university and also academic functioning. So, for example, a student with ASD may or may not, but may talk at length about their interest, and to another adult that might be perceived as odd, eccentric, or maybe even a little bit rude if they're not eliciting conversation topics from the listener. Students who are used to a very clear routine in elementary and secondary school may have challenges with things like unexpected changes in class schedule, pop quizzes that we see on college campuses and classes, canceled classes, and lack of seat assignment. Many of our students have preferential seating in secondary school, but that's certainly not the case in college and university, so that can cause some challenges. As we know, hyper or hyposensitivities, sensory sensitivities, has been added to the DSM-5 as a diagnostic criterion. And if you just take a moment to imagine all of the sensory stimuli on a college campus, for our students with ASD, this has been documented as quite challenging. So for example, they may have challenges with filtering out noises in the classroom or lecture hall, such as chatter. Fluorescent lighting, or even lighting like this, might be uncomfortable. And even fluorescent lighting, it produces a very subtle humming noise that many of us don't pick up on, but our students do. So sometimes the triggers can be so subtle for a student with autism spectrum disorder. And then you think about being in large auditoriums, and the echo and that vestibular input can be challenging for some of our students. And then we think about the Student Union building. I don't know if any of you have been to the old Student Union building at UBC, but boy, were there a lot of different smells and a lot of different noises and a lot of different lighting. I can appreciate diverse food, but it was very challenging for someone who doesn't have sensory dysregulation to cope with. And of course, there is a natural tendency or a norm to socialize in the Student Union building, so many of our students actually actively avoid these areas on campus just to keep things at bay and to cope. Some of my students live in campus residence, and you can think about the sensory sensitivities on a campus residence as well. Even thinking about the furniture that's provided. You know, you don't have a choice with the mattress or even the carpet or the lighting, and that could feel like pins and needles for some of our students. And it may not for some, so every student is different. Now, with respect to adaptive behavior, that's just a fancy word for independent daily living skills, and we know that adaptive behavior is often not commensurate or equal with the cognitive functioning of young adults with autism spectrum disorder, and you need a lot of independent daily living skills on a college campus. You need to follow your class schedule, you need to set an alarm clock to get to class on time if you're living on campus and you don't have your parent to prompt you. You need to follow a cafeteria meal plan, do some shopping, some cleaning, general hygiene. So remembering to brush your teeth and take a shower and wear deodorant, all these things that our students often need prompts for. And are important in terms of socialization too on a college campus. Now, with respect to academic functioning, we know students with autism often do well academically in high school, and that's what makes them good candidates for post-secondary education. Studies have shown that students with ASD have higher rates in STEM programs, so science, technology, engineering, and math, compared to students with other disabilities and compared to students in the general population. So that can make them good candidates for employment opportunities as well. However, there's lots of challenges with managing the multiple task demands and the demands that are placed on our executive function system. So for example, studying for many exams that are on the same day. I still don't know why universities do that. Term papers where you have to research in advance and write incrementally or sequentially can be very challenging for our students. And just managing more than one class at a time. And the next few bullets really warrant a talk in and of itself, but there are challenges with accessing educational accommodations, providing disability documentation, and self-advocacy skills, which are often compromised in students with autism spectrum disorder and other disabilities. But in keeping with the theme of this conference, I'm going to focus on psychiatric comorbidity and mental health and what that looks like on a college campus. We know that students with ASD have higher rates of psychiatric conditions compared to the general population and compared to individuals with ASD with significant cognitive impairment. Higher rates than individuals with ASD and intellectual disability. The prevalence rates do vary based on the studies, but generally speaking, up to 70% have one co-occurring condition and 40% may have two or more co-occurring conditions. Of these, anxiety and mood disorders are the most common co-occurring conditions in adults, and adults with ASD are more likely to be prescribed one or more psychotropic medication. Unfortunately, little is known empirically about mental health functioning in students with ASD attending college and university. Theoretically, what's been documented in theoretical papers that there are various factors that may lead to the onset or exacerbation of symptoms, including changes in environment, such as moving from a secondary school environment to a large college or university campus, coping with the academic demands that I just spoke about, and also the social demands. So it's been argued, and we see this, that the anxiety may result from difficulties in processing social information and just engaging in social interaction. And depression may be the result, and anxiety may be the result of repeated failures with respect to socialization or ongoing social rejection. The independent living challenges I already spoke about, and environmental stressors, so the sensory dysregulation in the student union building, cafeterias, classrooms, and some of our students actively avoid these areas just because they are so anxiety-provoking and overloading on their sensory systems. Now, I put together this very basic a picture that I think clearly depicts the challenges associated with ASD. As children get older and they approach adulthood, often it's not the ASD symptoms that are most impairing, it's the functional impact of the syndrome. So executive functioning challenges, independent daily living skills, learning to self-advocate for your needs, and of course, mental health. And so I like this because I think it clearly shows areas that we can target in terms of treatment. So although research and professional work in the area of adults with ASD in general is gaining further attention, to date this remains a population that has not been well studied, particularly with respect to their experiences in post-secondary education. Understanding the experiences of students with ASD is truly a necessity. We are truly seeing so many students transition out of secondary school, and it can provide valuable insight into their functioning in college and university, including successes and challenges.